Okay, so we are about to start a hairline advancement on this patient, and you can see that we have her hairline marked out and some potential new hairline locations anterior to that, which is towards the front of the face. So back towards the back, this incision here is where the incision will actually be placed, right along the dense part of the hairline, and then we will elevate the scalp and move it forward so that the hair-bearing part of the scalp is lower and the forehead itself is shorter, and this is a forehead reduction or a scalp advancement. And my intention is to bring her about 2 centimeters forward, which would get her to this line here. If we're able to move her a little bit more, that would get her up to about 3 centimeters, which will be all the way up to the front line. But her hairline now is about at 8.5 centimeters from her brows, and getting her to about 6.5 centimeters would be great, which will put her right at this line here and reduce the size of the forehead. Completed hairline advancement or forehead reduction. You can see we used a combination of staples and sutures to close this up. The hair is going to grow through that incision and it's going to disappear over the course of about 6 months, and she's going to do great.